Missing one dose usually is not the real problem. The real problem is the panic move right after it. With Wegovy, semaglutide, or Zepbound, tirzepatide, most people do not lose the whole treatment from one late shot. Most recover well from one simple delay. They get into trouble when they try to fix the delay with a rushed decision. That panic is easy to understand. You feel hungrier, the scale suddenly feels louder in your head, and you start thinking the medicine already stopped working. Then people double up. Some take the next shot too early. Others jump back in at a dose their stomach is no longer ready for. These drugs work over time, not in one dramatic burst. Their effect fades gradually, which means one missed dose may soften appetite control, but usually does not erase everything overnight. That early fact matters because it changes the first decision from catch up fast to restart carefully. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Wegovy and Zepbound stay in the body for days. That is why one missed shot does not usually create an instant collapse. Appetite control may weaken, fullness may fade sooner, and thoughts about food may start showing up more often. But the system does not suddenly reset to zero the next morning. A second process matters just as much. Your stomach and brain may have gotten used to a certain dose, then lost some of that tolerance during the gap. If you reintroduce the drug too aggressively, the same dose can feel less familiar than it did before. That is where nausea, vomiting, and reflux can flare. Timing creates the first major split. A person who is only a little late is not in the same situation as someone off the drug for much longer. People often treat both cases like one simple scheduling issue. The body does not always treat them that way. Dose stage creates the second split. If you miss a dose after months of stability, your body may handle the restart more smoothly. If you miss a dose while still stepping upward, your tolerance may be thinner. A thin tolerance makes rushed correction more punishing. A third difference also matters because the week around the missed dose changes how rough the restart feels. Some are missing a dose after a week of regular meals, sleep, and routine. Others are missing it after overeating, poor sleep, alcohol, or travel stress. The second person may feel worse after restarting, not because the medicine changed, but because the body is already under more strain. The rough week after a missed dose is often not caused by the missed dose alone. Bigger meals, faster eating, less hydration, and then a strong restart all pile onto the same body. The medicine gets blamed for a mess that behavior helped build. That is why two people can miss the same shot and have very different outcomes. One stays calm, keeps portions modest, drinks fluids, and follows the correct timing instructions. The other reacts like time was stolen and tries to overpower the gap. The second person often feels far worse, even though the original mistake was identical. Some people use the next injection like a reset button for an entire bad weekend. They eat as if the drug has vanished, then expect the next dose to clean everything up by Monday. That way of thinking is wrong. These drugs support habits, but they do not erase the consequences of a rebound cycle. Warning signs start when the situation stops feeling like routine appetite change and starts looking like real side effect burden. Repeated vomiting matters, severe ongoing abdominal pain matters, inability to keep fluids down matters. Those signs do not automatically mean something dangerous, but they do mean guessing is no longer a smart plan. Another warning sign is confusion severe enough that you truly do not know where you are in the schedule. If you cannot tell whether you should take the dose now, skip it, or restart differently, random timing can make the week worse. Uncertainty becomes a risk because the wrong next step can make side effects much worse. A third warning sign is repetition. When missed doses keep happening because of travel, pharmacy delays, avoidance, or side effects, the issue is no longer one late shot. It is a stop and start pattern. That pattern makes these drugs feel harsher, less predictable, and easier to quit. One more sign matters for real life. If the missed dose happened because you delayed it on purpose out of fear, that changes the problem. You may not be dealing with scheduling at all. You may be dealing with side effect dread, and that usually needs a different conversation than simple calendar advice. The main goal is not making up lost time. It is keeping your body used to the medicine while getting back to a regular schedule. Most people do better by getting back to their normal dosing routine than by rushing to make up the missed dose. A calm return is easier on the body than a rushed attempt to make up the missed dose. The rushed option can still feel like the safer move in the moment. The first action rule is simple. Do not double the dose. Do not take 2 injections close together unless your own prescriber has given you a specific plan. Faster is not better here. The usual result of aggressive catch-up is more stomach misery, not better weight loss. The second rule is just as important. Use the official instructions for your drug based on how many days have passed. Then match that with your prescriber's guidance if you have it. The instructions are not identical for every drug. After a long enough break, some people need to restart at a lower dose instead of jumping back to the last full dose. Once the restart timing is clear, manage the next 2 days as if your stomach may get upset more easily than usual. Eat smaller meals and slow down. Avoid very heavy or greasy food and push fluids steadily. Those steps lower the chance that a planned restart turns into a much rougher reaction. If symptoms stay mild and the timing instructions are clear, continue with that simple plan. Keep meals small, keep fluids steady, and keep the next 2 days simple. If symptoms are escalating, hydration is failing, or the restart plan is unclear, contact your clinician instead of improvising. Prevention is mostly about removing friction before life gets messy. Pick 1 injection day and 1 reminder system. Build 1 backup plan for travel, weekends, and refill delays. Keep the process boring enough that you do not negotiate with yourself each week. Boring systems prevent dramatic mistakes. It also helps to decide now what a missed dose means in your own routine. Know where the drug instructions live. Know how you would contact your clinic. Know when you would stop guessing and ask for help. Decisions made before panic are usually better than decisions made inside it. 1 missed dose of Wegovy or Zepbound usually is not treatment failure. The bigger danger is the catch-up mistake that follows it. Steady timing, calmer eating, and the right restart plan matter more than trying to punish 1 imperfect week. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.